Hiya, welcome to Biomed Sessions with me, Ruse. Today I'm going to be answering frequently asked questions about COVID-19. I have based this video mainly on information from the World Health Organization, WHO, and NHS resources. However, this is my own personal interpretation of information available as of 5th of April 2020. Bear in mind that there are updates every day regarding COVID-19 and that I'm based in the UK. Okay, let's get into it. What is COVID-19? COVID-19, short for Coronavirus Disease 2019, is an infectious disease which is characterized by respiratory symptoms and caused by a coronavirus. It was first identified in Wuhan, China in 2019, but now the WHO has classified it as a pandemic, which simply means it is a disease that is widespread, in this case globally, with multiple countries reporting deaths as a result. It is thought to have originated from an animal, most likely a bat. COVID-19 is not the only disease that is caused by a coronavirus. Coronaviruses are actually a large family of viruses which cause respiratory infections. However, each type differs in relation to the general severity of disease caused. By the way, corona is Latin for crown, thus this group of viruses are named after their crown-like appearance under a microscope. You may be surprised to know that the common cold can be caused by a coronavirus in a minority of cases. But also, the SARS epidemic in 2002 was related to a coronavirus of the name SARS-CoV. COVID-19 is caused by a similar coronavirus, SARS-CoV-2. Like other respiratory viruses, if SARS-CoV-2 enters our airways, it has the opportunity to hijack our cells and use cell resources to replicate, thus increasing the amount of virus in the body and making us ill. What are the symptoms of COVID-19? The main symptoms are fever, persistent cough, and shortness of breath. Symptoms such as sore throat, sneezing, and runny nose are not so common and are typically associated with the common cold rather than COVID-19. Whilst we should look out for symptoms, it is important to recognise how varied the severity can be. Most people that are infected will have a mild disease, and a certain proportion will literally be asymptomatic, i.e. show no symptoms. But some infected individuals are heavily impacted, developing severe pneumonia, potentially with life-threatening complications. Pneumonia, in simplified terms, means the small air sacs of your lungs, known as alveoli, become inflamed due to infection by a microorganism, e.g. a virus. Pneumonia can lead to acute respiratory distress syndrome, ARDS for short, i.e. an aggressive inflammatory response which leaves the lungs fluid-filled and stiff. ARDS interferes with the lungs' usual job of getting oxygen into the body, vital for organ function. Another major complication is sepsis, which is a systemic and potentially life-threatening inflammatory response to infection, which may cause multiple organ dysfunction, with many associated symptoms and signs. This requires immediate intervention. It is important to stress that severe disease only occurs in a minority of COVID-19 cases. So, who is most at risk of severe disease? COVID-19 can affect individuals of any age, but it appears that older adults, 65 and over as an arbitrary figure, and individuals with pre-existing conditions such as hypertension, cardiovascular disease, and diabetes are most likely to develop severe illness. Children are susceptible to getting COVID-19 and there have been deaths reported, but generally, children seem to present with mild symptoms, although new information is always emerging. In relation to deaths, it is hard to know the true mortality rate of COVID-19, as in some areas there is not sufficient data regarding the total number of individuals infected for reasons such as lack of testing. How is SARS-CoV-2 spread? SARS-CoV-2, i.e. the coronavirus responsible for COVID-19, is thought to spread mainly via respiratory droplets. When an infected individual coughs or sneezes, virus-containing droplets are released, and the smaller droplets can hang in the air and be breathed in by another person, thus passing on the infection. Droplets can also land on surfaces, contaminating them. An unaware individual may touch the surface and then touch their eyes, nose or mouth, thus providing the virus with a route of entry into the body to infect them. Some sources suggest that respiratory droplets can linger in the air for up to 3 hours and survive on surfaces anywhere from hours to days, dependent on factors such as temperature and surface type. What can you do to protect yourself and prevent the spread of disease? Keep up to date with information from the WHO and your health authorities in order to stay aware of disease prevention measures. Frequently decontaminate your hands, ideally by washing your hands with soap and water for at least 20 seconds, or use hand sanitizer gel if soap and water are unavailable. Avoid touching your face with unwashed hands. Cough or sneeze into tissues, then dispose of them and then wash your hands. It is also helpful to regularly disinfect surfaces as they may be covered with respiratory droplets. So what's all this talk about social distancing? Social distancing is the act of increasing physical space between yourself and others in order to reduce the chances of getting or transmitting disease. Examples of what you can do include maintaining a distance of at least 2 meters from other people, working from home, but of course this is not possible with some key jobs, avoiding large gatherings. The government has helped to enforce this by shutting down venues such as restaurants and leisure centres, keeping in touch with friends and family remotely rather than physically, avoiding non-essential use of public transport. It may be frustrating to cut out these activities. However, social distancing really does reduce the chances of you breathing in or picking up someone else's virus-laden droplets through close contact. So get creative in avoiding other people. And what about face masks? Face masks are generally worn by those who are looking after someone with suspected or confirmed disease, or if they themselves have suspected or confirmed disease. However, guidelines around the use of face masks are constantly being updated, with people looking into how far a sneeze or cough can spread respiratory droplets. And it is also important to bear in mind that different types of face masks offer different levels of protection. Oh, and what about self-isolation? Self-isolation usually means deliberately not leaving your home when you have symptoms suggestive of COVID-19 or have tested positive. It is based on the principle of keeping yourself away from others during the time when you could be infected. Members of the household of an affected individual are typically required to self-isolate for a longer period of time. This takes into account the incubation period, i.e. the period of time where someone may have been unwittingly infected but are not yet showing the symptoms or signs. Currently, sources say that COVID-19's incubation period can range anywhere from 1 to 14 days. However, the average onset of symptoms is around 5 days. Of course, if your household is being isolated, close attention must be paid to techniques that prevent disease spread, and you should try to avoid sharing items as much as possible. In relation to self-isolation, follow the advice of your health authorities. This is the NHS if you live in the UK, and you can find the latest guidance on the NHS website about what to do if you develop symptoms. The caveat is that prompt medical attention must be sought in worsening or severe illness, as a smaller proportion of people will require hospital admission for supportive care. Call ahead if you are seeking medical attention, because you don't want to inadvertently spread the virus by turning up unannounced to a medical facility. Additionally, it is recommended that certain people who are more at risk of severe disease, e.g. older adults and those with certain underlying health conditions, self-isolate throughout the pandemic in order to avoid being infected. Of course, this means careful planning around the receipt of essential items such as groceries. How is COVID-19 diagnosed? Tests are not always carried out, and an individual may be asked to self-isolate on the suspicion of having COVID-19 as opposed to being a confirmed case. Sometimes this is due to limited testing capacity, thus a need to divert resources to sectors of perceived greater need, such as in the assessment of hospital inpatients. The most common way of testing for SARS-CoV-2 is by first collecting a nasopharyngeal or oropharyngeal swab, i.e. a nasal or throat swab. This sample is then sent to a lab, where they are analysed using a technique called RT-PCR, which identifies whether genetic material associated with the virus is present in the sample and thus identifies whether the individual is infected. Results are usually available within 2 days. Also, an acute serology sample can be collected, which, from what I understand, is a blood sample to detect whether antibodies have been produced as a general response to infection. A CT scan may be useful in a certain proportion of patients to characterize lung changes which commonly show up as bilateral opacities in patients with COVID-19, although these changes are not specific and not always present. How is COVID-19 treated? Currently, there is no vaccine and no specific medication to treat COVID-19. Neither will antibiotics work because we're dealing with a virus, not bacteria. Most people have mild or uncomplicated disease which doesn't require hospital intervention, but a small proportion with severe illness will require hospital admission for supportive care such as oxygen supplementation, intravenous fluids, and close management of any coexisting conditions. A smaller proportion may develop acute respiratory distress syndrome, ARDS, requiring mechanical ventilation, i.e. use of a ventilator to assist or replace breathing in someone who is unable to do so spontaneously. This is a life-saving intervention. There are limited numbers of hospital beds and an even more limited number of ventilators available. Hence, it is important that the public engages with measures to slow down the spread of disease in order that the number of patients with severe illness requiring hospital beds in general or intensive care unit admission for ventilatory support does not surpass the number of beds and ventilators available. Currently, trials are underway to develop a COVID-19 vaccine. However, a vaccine is unlikely to become available for several months. Therefore, in the meantime, you can help to save lives by hand washing, social distancing, and self-isolating. Okay, so if you found this video useful, like and share. And if you want to see more videos like this, then do subscribe. Links to resources will be in the description. Okay, see you in another video. Bye.